expected outcomes. Informed consent isn't merely a legal formality, it's an ethical obligation and a critical aspect of patient autonomy. When patients are fully informed, they can participate actively in their care, ask questions, and make decisions based on a comprehensive understanding of their treatment options. The process of obtaining informed consent begins with clear communication between the surgical team and the patient. The surgeons must explain the procedure in layman's terms, ensuring that the patient comprehends the purpose of the surgery, the potential risks, and the expected recovery process. It's essential that the patient understands not only the technical aspects of the surgery, but also the possible complications such as infection, anesthesia risks, or post-operative challenges. In many cases, nurses or other healthcare professionals may be involved in this educational process, providing additional resources, answering questions, and offering emotional support. A well-informed patient is more likely to feel confident and reassured, which can contribute to a smoother surgical experience and recovery. Following patient education, the preoperative assessment is a vital step in surgical preparation. The goal of this assessment is to evaluate the patient's overall health, identify any risk factors that could complicate the surgery, and ensure that the patient is physically prepared for the procedure. Preoperative assessments are comprehensive and may include a review of the patient's medical history, physical examination, laboratory tests, and consultations with specialists if necessary. The assessment ensures that the surgical team is aware of any pre-existing conditions such as diabetes, heart disease, or allergies that may require special attention during surgery. A key part of the preoperative assessment is the evaluation of the patient's cardiovascular and respiratory status, as these systems are directly impacted by anesthesia and surgery. Patients may undergo blood tests, chest x-rays, and electrocardiograms or EKGs to assess their heart and lung function. In some cases, pulmonary function tests may be required, especially for patients with chronic respiratory conditions like COPD. Identifying and managing these risks before surgery helps to minimize the likelihood of intraoperative complications and improves the overall safety of the procedure. Another important component of surgical preparation is surgical site marking, a procedure that may seem simple but is vital for preventing wrong site surgeries. The surgical site is typically marked by the surgeon in the presence of the patient while they are awake and able to confirm the correct site. This marking is usually done using a surgical marker and is a visible reminder to the entire surgical team of the exact location of the intended procedure. The surgical site marking is part of the broader effort to adhere to the World Health Organization's surgical safety checklist, which includes protocols to confirm patient identity, the procedure being performed, and the site of the surgery. Sadly, accidents have happened. This step is not just about following protocol. It's about ensuring absolute clarity and communication among the surgical team. In the busy, fast-paced environment of an operating room, even small errors can have significant consequences. Wrong site surgeries, although rare, can have devastating effects on patients and erode trust in the healthcare system as a whole. Surgical site marking is a simple but effective safeguard against such errors. everyone is on the same page before the first incision is ever made. Once the patient has been educated, assessed, and the surgical site marked, the next step is the surgical scrub. The surgical scrub is one of the most iconic and fundamental aspects of preparing for surgery, and it plays an important role in preventing infections. The scrub involves a rigorous hand-washing technique performed by the surgical team, which includes not only the surgeon, but also the scrub nurse, anesthesiologist, and many other personnel who will be involved in the procedure. The surgical scrub is designed to reduce the number of microorganisms on the skin and prevent the transmission of bacteria into the surgical field. The process of scrubbing typically involves the use of antimicrobial soap and a methodical washing technique that lasts several minutes, focusing on the hands, forearms, and underneath the nails. This thorough washing is followed by the donning of sterile gloves and gowns, which further protect the patient from infection. While modern surgical settings may also use alcohol-based hand rubs that are fast-acting and effective, the traditional surgical scrub remains an essential ritual that underscores the importance of maintaining a sterile environment. Once the surgical team has completed the scrub, the next crucial step is the establishment of the sterile field. The sterile field is the area around the surgical site that's free of microorganisms and is protected by sterile drapes, instruments, and equipment. The maintenance of a sterile field is critical for preventing surgical site infections, which are among the most common complications following surgery. The sterile technique involves not only draping the patient, but also ensuring that all surgical instruments, gowns, gloves, and materials used during the procedure are properly sterilized. Maintaining the sterile field requires constant vigilance from the entire surgical team. Any breach of sterility, such as a team member accidentally touching a non-sterile surface or a piece of equipment falling to the floor, must be immediately addressed. The item is removed as it is contaminated at that point, and the team takes steps to restore sterility, such as changing gloves or redraping the patient. The sterile field is sacred in the operating room, and preserving its integrity is a shared responsibility among all team members. Technology has revolutionized the way surgical prep procedures are conducted, adding layers of precision and efficiency to every step of the process. One of the most significant advancements is the use of imaging technologies, such as CT scans, MRIs, and intraoperative imaging, which allow surgeons to visualize the patient's anatomy in greater detail before and during surgery. This preoperative imaging helps guide the surgical plan, ensuring that the procedure is as targeted and minimally invasive as possible. Another key technological advancement in surgical prep is the use of computer-assisted surgery and robotic systems. Robotic-assisted surgery allows for greater precision, dexterity, and control during complex procedures, which can reduce the risk of complications and improve patient outcomes. These systems often come with integrated preoperative planning software that allows surgeons to simulate the procedure in a virtual environment before stepping into the OR. This level of planning and precision is particularly beneficial in procedures that involve delicate structures such as neurosurgery or process. EMRs allow the surgical team to access the patient's complete medical history, test results, and preoperative assessments in real time, ensuring that everyone involved in the surgery is fully informed and up to date. This reduces the risk of communication errors and ensures that the team can make informed decisions based on the most current data. Continuous training and adherence to protocols are the backbone of effective surgical prep. In a field as dynamic and complex as surgery, ongoing education is essential for keeping healthcare professionals updated on the latest techniques, technologies, and safety standards. Surgical teams must undergo regular training, sessions, simulations, and competency assessments to maintain their skills and knowledge. This is especially important in areas like sterile technique, where even a minor lapse in protocol can lead to serious consequences. In many hospitals, simulation-based training is becoming an integral part of surgical education. These simulations allow surgeons and their teams to practice complex procedures in a controlled environment where mistakes can be made and corrected without risking patient safety. This type of hands-on learning helps build confidence and ensures that team members are prepared for the challenges they may face during real surgeries. In addition to individual training, the surgical teams must work together to develop and follow standardized protocols that promote safety and efficiency. Protocols such as the surgical safety checklist are designed to ensure that every step of the surgical process, from patient education to the establishment of the sterile field, is performed consistently and correctly. Adherence to these protocols not only improves patient outcomes, but also fosters a culture of safety and accountability within the operating room. The process of surgical preparation is a complex endeavor that involves careful coordination between the surgical team, the patient, and the technology at hand. Each step, from patient education and informed consent to the establishment of the sterile field, plays a critical role in ensuring the safety and success of the surgery. As we continue to advance in surgical technology and refine our protocols, it's essential that we remain committed to continuous training, vigilant practice, and patient-centered care. By doing so, we can ensure that the operating room remains a place of healing and precision, where the art and science of surgery